Atopic eczema is a condition that affects up to 25% of children.
The term eczema is quite interesting because it actually comes from the Greek word to bubble up or to boil over. And I think that really describes how most patients feel when they have got eczema. It's an inflammation of the skin.
The skin barrier is the top of the skin, and this can be visualised like a brick wall, with the skin cells as the bricks and the fat round them is like mortar. In someone without eczema, the bricks are surrounded by a thick layer of fat which keeps water in them, so they swell up. This prevents cracks forming between them, so that allergens cannot penetrate through the brick wall, through their skin barrier. In a child with eczema, the skin barrier is very different. It is thinner, and the mortar, the fat, is broken up, and so the water leaks out and the skin cells shrink. Then allergens can penetrate through the cracks and then cause inflammation. That makes the skin go red and itchy. But the initial problem is this change in the skin barrier, in the brick wall. It's breaking down.
Means that the skin is drier, it doesn't retain the water as much, and it can become inflamed and red and itchy. It is associated with asthma, eczema, hay fever, urticaria and some food allergies as well. So it comes under the umbrella of atopy.
Atopic eczema is caused by interactions between our genes and our environment. We now know that there are changes in several genes that mean that the skin barrier is defective in children with atopic eczema, and environmental factors interact with these. A classic example is soap and detergents. So soap and detergents make the barrier breakdown much worse in a child with changes in several genes. Emollients are a simple, effective way to repair the skin barrier. They contain oil, which forms a layer over the surface of the skin that traps water underneath it. The water then penetrates into the shrunken skin cells and they swell up. This closes cracks in between them, preventing the penetration of irritants and allergens, and so preventing flares of eczema.
Emollients soothe and they soften and they rehydrate the skin of eczema, and they're a natural, what we call anti-pruritic or anti-itching cream, and there's no way you can overuse moisturisers. They're extremely important for reducing the amount of inflammation in mild to moderate eczema sometimes. With the more severe cases, you might have to use them in combination with topical steroids. But there are many children that we see in our clinical practice their eczema can be managed very well with just topical emollients. So Anna, what we're going to do now is I'm going to moisturise your arms and legs. So if we take this off, and we've left that somewhere really nice and warm on the radiator so that it's not too much of a shock when it goes on Anna's arms and legs. And I'll just show you how much we're going to be using. Okay, shall we start with your arms, Anna? Is that okay?
Emollients need to be used in sufficient quantities to repair the skin barrier effectively. So just using 10-20 grams a week will have little effect. They need to be used at 500 grams a week. That's the average for a child, more for an adult. If they're used in these quantities, they will produce a good repair of the skin barrier and so prevent flares developing.
I'm going to warm it up in my hands, and then I'm going to apply it using downward strokes. Okay. And leave that to soak in. It's really important that the healthcare professional that's involved with the child establishes how easy it is for the parent to do this. And it's quite easy to get a huge amount of moisturisers on a baby, for example, but then on a toddler or a child that's a little bit older, it is quite difficult, particularly if they're at school. We would say the gold standard is getting through 500 grams, which is one pump dispenser, of moisturiser per week. And in fact, we actually have patients that go through 2 of those. But it depends on what stage the eczema's at. If the eczema's particularly dry, for example, in the winter, if they have a flare-up, they may be using more moisturiser. Or you can use different kinds of moisturiser during the day. So, for example, you could use a thick, greasy cream at night, for example, an ointment, and you could use a cream-based during the day or in the morning before the child goes to school or the young adult goes to college.
Pump dispensers can make it much easier to dispense the right quantities. Some pump dispensers dispense very large volumes, and that makes it very easy for the child and their parents to put on a large amount of emollient very quickly. That's important if you're treating a young child, because the quicker you can put the emollient on, the easier it will be.
And to apply this to Anna's legs, making sure that we cover all areas, not just the areas that we see that are dry or that have eczema.
Emollients should be applied in the direction of hairs so they don't block the hair follicles, but they should not be rubbed into the skin because rubbing can induce itching. So the skin will appear white after the emollients have been put on the skin. They will then soak in over the next 10 to 20 minutes.
Parents will always feed back that when they are using enough moisturiser, the skin of the child does feel softer, smoother and less likely to flare up. And I think it's very important to try and aim for that in a week. And it's important not to run out of it as well, so to make sure that the GP prescribes enough so that you don't run out, because if you do run out of the prescriptions and have a few days where there's no moisturisers available, parents will give me the feedback that their child's skin is altered and is compromised by it. Well, with moisturisers, you have to make them fun, because I think if you're using them day in and day out, which the majority of eczema sufferers have to do, it can become tedious and it can become a bit of a challenge to parents, particularly when children are 2 to 3 years of age. It's not so bad when they're a baby, but when they get to the toddling stage, they may be uncooperative. So I would make it fun, for example, putting these stickers on. Encouraging the child to apply on her dolls. So we have a selection of Barbie dolls here, or you could use smaller dolls. And what Anna used to do when she was little was apply them to all her dolls at the same time as when I was applying them to her. Well, depending on the age of the child, if they're perhaps 2 or over, you can make it a bit more interesting, particularly when you're at home. You can have certain times designated for creaming times, for example. Put some videos and DVDs on, or even get some special toys in a box that you use just for creaming time so that you can distract the child. A lot of it is about distraction and making the actual creaming session a bit more interesting.
Patient preference is central to the use of emollients. If a patient, and that includes a child, does not like the way emollient feels on their skin, of course they're not going to use it. We've found that children as young as 5 will pick their favourite emollients from a tray of emollients, and we use all the emollients that are available to us from the British National Formulary, and they'll say, oh, this cream feels really silky. So that when we then prescribe that emollient, they're empowered to use it. In fact, our pharmacies stock the emollients based on the children's choice. So tailoring emollient therapy to the choice of a child and an adult is an essential part of emollient prescribing.
If there are other brothers and sisters in the family, or even grandparents and uncles and aunts, try and get them involved in the creaming process as well. Because I tend to find that children who have got eczema take up a large proportion of their parents' time, and sometimes the other children in the family, the brothers and sisters, can be forgotten about. So getting them involved in the creaming time is quite helpful. And also makes the child feel that they're the same.
Pump dispensers are also a very important way to reduce the chance of contamination of emollient creams with bacteria. If they're in open pots and the child or their parents put their hand into the pot, then that increases the chance of contamination. So if it's an emollient ointment, we advise them to decant it with a spoon, because they can't be dispensed with pump dispensers. If it's a cream, the ideal is to have a pump dispenser.
When we use moisturisers in the hospital, we advocate the use of a good and consistent emollient regime, which means that you're using a bath oil, a soap substitute and a moisturiser. Now I'd add 2 more into that equation, I think it's very important that you don't use nappy wipes, which can further deteriorate the child or the baby's skin, and also a good shampoo, which does not have any colourings and preservatives and fragrancing in it. So bath oil, soap substitutes, moisturiser, good shampoo, and either not using baby wipes or using baby wipes that are alcohol and preservative free.
Cleansing the skin in people with atopic eczema is extremely important because they have large numbers of bacteria, in particular Staphylococcus aureus, sticking to the surface. But of course we can't use soap and detergents because they break the skin barrier down more. And in fact, once the barrier is broken down more bacteria stick to it. So it's essential to use emollient products to wash the skin. Emollient bath oils, shower products and sink soap substitutes based on emollients, because they allow the skin to be cleansed without damaging it, and that is an essential part of the management of atopic eczema.
Once the child comes out the bath, they're well moisturised with the bath emollient. Apply the steroids straight away, leave a sort of 15 to 20 minute gap, and then put the moisturiser on top. The reason why you wouldn't use a steroid and a moisturiser together at the same time is because it dilutes the potency and the properties of the steroid.
It's important to use emollient products for the purpose they were designed for. There are two broad groups: leave-on emollient creams and ointments, and wash-off emollient products. That's a wash-off bath product, shower product, or an emollient sink-side wash product. If a product is used for the wrong purpose, it can have adverse effects. The classic example is aqueous cream. This is an emollient wash product. It was never designed to be left on the skin. So used as a wash product, it has an emollient activity and some cleansing activity. If it's left on the skin, it can cause severe irritation, and that's because it contains 1% sodium lauryl sulfate, the harshest of all the detergents.
I think very often moisturisers or emollients are underused or undervalued. I'd like to stress the fact that they are an active treatment, not a passive treatment, and that you need to be using 500 grams a week of your chosen moisturiser, along with your soap substitutes and your bath oils, for your child's skin condition to be maintained properly. So you're aiming to get through 1 tub of moisturiser in a week and be using it every single day religiously on all areas of the body, not just the areas of eczema that you can see visually. Is it worth it? If you were speaking to other parents, is it worth doing this continual emollient regime?
Without a doubt, completely without a doubt, because Billy is so much happier, his skin's so much better, and just to see him laughing and not scratching, and when he was sore and his face was weeping, just not to see that, it's so good for Billy. But for me, because it's heartbreaking when you don't think you can do anything. It really is. And to actually be able to do something and make it better.
The most important aspect of emollient therapy is to use them, and to use them in sufficient quantities with education about how much to use. So it's teaching children and their parents about how much emollient to put on, when to put it on, how to apply it following a bath with an emollient bath oil. So use emollients in sufficient quantities and give them education to empower them to use them properly.